Hey everyone, Julian Corwin here, Pain and Performance Solutions. Today I want to talk to you guys about low back pain. Now, we're often told stories of other people who've had back pain, or they've had, let's say, a disc injury. Disc injuries can cause a lot of different types of pain, and but so can another problem that is a lot more innocuous, a lot easier to resolve than a lumbar disc injury. So I want to go over some of that with you today, and we're going to use the skeleton here. So lumbar vertebrae, we've got 5 lumbar vertebrae here. 1, 2, 3, 4, 5. Now on the front of the vertebrae, we've got these little discs. So this is L5S1 disc, L4, L5. That's how they're denoted by what vertebrae they sit between, okay? Now, sometimes when we get a lot of lumbar compression, these discs can push against the nerves, which can then cause radiating symptoms down the rest of the body. It can also cause local pain here, okay? So this is what we probably think of most of the time. Hey, I think I have a disc problem or something in my low back. But what I actually see way more often is a problem here, which is just a simple joint problem. Sacroiliac joint is what it's called. Sacroiliac joint. This is the sacrum, this is the ilium. Okay. Now, what happens there? Well, every step we take involves a full opening and closing of that joint. As we bear weight into the ground pushes back. If it didn't, we would fall through the earth. If we take a look at this little chart, this is a anatomy motion chart. It involves every movement of the body through all phases of gait. If we look at the SIJ here, there's moments when it's open in a couple dimensions and closed in another, one where it's closed entirely, and one where it's open entirely. Now, this joint is very thin, or that is, the space in there is very small, and it's just simply closing during one phase of gait and opening during another. Now, if that opening and closing doesn't happen, we don't get enough blood flow, we don't get enough flow of fluids into the joint to heal the joint from daily wear and tear. If it's chronically open, we can also get pain because those ligaments are on stretch. And there's no way to push fluids out if it doesn't compress. We often assume that blood flow is just like this thing that happens and it's perfect, but flow in the body also involves joint movement, muscular movement of the body. It's not just that heart that's at work. We've got lots of other mechanisms throughout the body that are pumping fluids to irrigate the body, irrigate the joints, provide nutrients to different cells and bones, okay? So what I find is that tons of back pain and hip pain is really centered around a misalignment of the pelvis. The pelvis is either pushed forward, kind of rotated. Let me show the skeleton here. The pelvis is either anteriorly tilted or posteriorly tilted, or unlevel. That is, we've got a hike on one side or drop on the other, or it could be rotated too. Now, rotation of the pelvis this way, you could see it would open the left SI joint a little bit more on one side and close it more in a different way on the right side. Either one of those can be attributed to, or can be related back to some pain in the low back. Now, if I let's just look up sacroiliac joint pain on Wikipedia, and I'll read you what it says here. Signs and symptoms of SI joint pain is a dull ache on one side of the lower back that may extend into the thigh. Pain can range from an ache to a sharp stabbing pain that extends down one or both legs. Low back pain while climbing stairs. Activities that require the pelvis to twist may produce SI joint pain. Again, we talked about that misalignment. If you further go into that rotation, it can aggravate the pain, stretch the ligaments of the SI joint more, or compress them more. Often experienced as an ache on one side that causes the person to shift weight to one side to relieve the pain in the other. So, low back pain, buttocks pain, sciatic leg pain, groin pain, hip pain, Basically, everything you've ever heard when it comes to back pain can be attributed to the sacroiliac joint. Pain can increase or decrease with physical activity. Symptoms can worsen with prolonged sustained positions, sitting, standing, or lying. The only main difference, I would say, kind of a big differential diagnostic piece here, that is we're able to distinguish SI joint pain from maybe a lumbar disc problem, is that SI joint pain rarely radiates below the knee. So if it's radiating below the knee, affecting numbness in the foot, pain in the foot as well, then it's probably going to be a disc thing. And if it's a disc thing, first thing you want to do is get some traction into the lumbar spine. We'll talk about that more later. First, I want to go over real quick, what would our approach be for solving a problem in the SI joint? And then we go back to this map, essentially. First we got to find out, is it open or is it closed? And then in these moments in our gait cycle, let's say the person's SI joint is chronically closed. Then in all likelihood, they can't do something in this chart that relates to opening that SI joint. Oftentimes, let's say someone has a flat foot. That means they can't externally rotate their rear foot. So we go over here and we see that external rotation of the rear foot is related to opening the SI joint in the transverse plane. So maybe they had an ankle sprain there. Maybe their foot just never got stimulated enough because we're on flat surfaces in shoes all day long. And that can very much affect the function of the foot. It's funny how often I hear people say, yeah, I know everything's all connected. Foot bone connected to tibia bone, connected to femur bone, connected to connected to the pelvis, connected to the sacrum. But when I tell them that, hey, your back pain is likely coming from an ankle problem, this is the ankle problem, they're a little bit skeptical. They're skeptical, that is, until we actually tie those pieces together, and they, sure enough, don't have as much back pain. So I'm just going to switch the camera here, and I'm going to show you kind of in my body, from the bottom up, how this happens. So if we just look down at your feet, and let's say you got one foot that's a little bit flatter than the other, okay? That causes a slight internal rotation of this tibia, internal rotation of the femur, which then would bias the pelvis to be in a slightly different position. And you can see we're already all the way up to the pelvis. And biasing the pelvis in a certain direction would change its contact with the sacrum. And lo and behold, there you have it. Sacroiliac joint pain and dysfunction. Anyways, that's my approach on back pain. It's usually SIJ related. Most commonly it is, at least. Hope you guys found this video helpful. And if you got any problems, you should be able to find the link to my website down below, and call me up for a consultation or a first appointment. Cheers. Have a good one.